Hi, this is Ken Herron again, and I'm on my back porch. And I'd like to talk to you for just a few minutes about improving our healthcare system. Obamacare, the intent of that was not to improve our uh, healthcare system, it was to permit a federal takeover, nationalize the healthcare industry, and let the government control it. Now, the government can't control anything, so we certainly don't want that. One of the biggest problems that the medical profession has is lawsuits. What's needed is tort reform. Texas passed that about 10 years ago, and it's been unbelievable what's happened in their medical system since then. One hospital saved over one hospital chain saved over $100 million in that 10-year period. Uh, there are now twice as many doctors as there were. The provisions of this tort reform was that there's no limit on the damages for medical treatment. You get all the medical treatment that you need to make you whole. But the punitive damage can be no more than $250,000. And if you sue a medical doctor or hospital and you lose, then you have to pay all of the legal fees. So that alone has cut down quite a bit on the lawsuits that they've had. One thing that the medical profession, I think, needs to do, the doctors and the hospitals, is to establish a standard price for themselves. They don't have to be the same as the next guy down the street, but they need to establish a standard price for their service. They put out an extremely high price, and if you're covered by Medicare, then you're going to pay 35% of that price. If you're covered by an insurance company, you might pay 50% of that price. But why not just let it be the price that it is? If an insurance company wants to do business with the hospital, let them pay the price that the hospital says is reasonable. And let the hospital give reasonable prices and not try to gouge anybody. There's always a hospital in the next town that the customers and patients can go to if they need to. But let's get the pricing right. And then on Medicare, instead of having the government operate the Medicare system, there's about 40 million seniors who are eligible for Medicare. Why don't we let the government take the money they're taking out, let them pay that to a private insurance company, and let them take care of the insurance plan for the senior citizens. We paid in a bunch of money in Social Security designated for medical. So let the government, the Social Security fund, maybe double the premium that they've been taking away from the seniors. Let them take that, let them match that so that there'll be twice as much money. And that would interest many, many insurance companies to handle that. We're paying probably $110, $15 a month. If you had $230 a month per person, any insurance company would be interested in handling that, and you wouldn't have the same situation as you've got now. The Obamacare system was set up, or the Obamacare law was passed in order to try to take care of those people who don't have insurance coverage. Right now, there's about 15.7 or 0.8% of our population, 44 million people, who do not have insurance coverage. Now, they are getting treatment. Most of them are getting treatment by going to the emergency rooms and getting treatment, and then the other patients at the hospital pay for it. But there is a thing called Medicaid, and it's a state-operated help for people who need medical help. I'd like to see us go back to the county